All right, and with that, we're going to get into our topic. As as we mentioned, we're covering today effective communication with Latin American Indigenous populations in national emergencies. So our learning objectives for today, we're going to increase knowledge about Latin American Indigenous ag worker communities' health during national emergencies. We're going to describe the challenges that ag workers face during national emergencies, specifically Indigenous ag workers. And we're going to describe effective communication with Indigenous ag worker patients during a national emergency. We're going to get started with getting to know Indigenous communities a little bit better. In order to communicate better with these populations, we need to get to know this community. Who are they? So we're going to give some background in Latin American Indigenous communities in U.S. agriculture and more broadly. We'll start by zooming in on Latin American Indigenous populations in U.S. agriculture. And this is really not a widely known community. Now, first, a point of clarification. Many people, when they hear Indigenous populations, assume that these are U.S. Native American communities, but we are focusing today on Latin America because the vast majority of Indigenous peoples employed in U.S. agriculture are from Latin America rather than the U.S. And the National Agricultural Worker Survey reports that about 6% of California ag workers are Indigenous. However, the National Center for Farmworker Health conducted non-randomized surveys in 6 counties across the southern U.S. And in those surveys, workers reported closer to 13% Indigenous. So as you'll see here on your right, that 5 or 6% was the least we saw. And some counties were closer to 30%. So there may be more Indigenous peoples in your community than you would expect. And higher numbers reported some combination of identifying as racially Indigenous or speaking an Indigenous language. So many will not self-report as Indigenous because of issues of discrimination that we'll discuss in a moment, but they do actually speak an Indigenous language. And like we said, there is such a lack of data on this community. So we're going to talk a bit about Latin American Indigenous populations more broadly to come to understand a bit more about them. So now we're kind of zooming out of the US and into Latin America as a whole. And we'll focus a bit more on Mexican and Guatemalan Indigenous communities because this is where many Indigenous agricultural workers are from. But you may see people from other communities as well. So around 40 million people self-identify as Indigenous throughout Latin America. And something to remember throughout this presentation is that Indigenous peoples in Latin America are spread throughout Central America, South America, and the Caribbean. So we're talking about 2 continents and millions of people here, which means that there are no sweeping generalizations we can make. These Indigenous groups are highly diverse in their culture, languages, foods, and religion. And when we talk about Indigenous communities, remember that some of these are anecdotes that apply to one community and not all. So to speak to some of that diversity, it is estimated that there are between 550 and 700 different languages and 70 language families spread throughout Latin American countries. And unfortunately, one thing that many Indigenous peoples do have in common is that they experience disproportionate poverty levels in their home countries. For example, in Mexico, 81% are considered extremely poor, as defined by the United Nations. So a bit more about the languages of Latin American Indigenous workers. Many workers from Mexico and Guatemala are Indigenous. You'll see here in this map to the left here, the proportion of the populations in these Mexican states that speak Indigenous languages. with some topping out around 12%, where that orange is the deepest in the south and the east of the country. And Mexico and Guatemala have among the largest indigenous populations in Latin America. There are 68 different indigenous groups in Mexico and include about 20% of Mexico's population. And up to 40% of Guatemalans speak an indigenous language. And among languages, there are many variants, some of which are mutually intelligible, but most are not. So earlier we mentioned that between 550 and 700 languages exist. And then among those languages, there are many variants. So I'm super curious, can you name any Latin American indigenous languages or variants? It's okay if you can't, but I'm curious to see which ones you're familiar with. So you'll have two options for how to participate in this word cloud. You can either scan this QR code. So if you have your cell phone nearby, you can just open up the camera and hover it over this QR code, and a link should pop up for you to follow. I'll give you just a moment to do that. Or the other way that you can participate is by going to www.menti.com and using this code that you'll see here at the top, 54933934. And notice that there is a space in between those. So if you choose to participate in either of these ways, you can go to this website and you can submit multiple answers and just let us know, are there any Latin American indigenous languages or variants that you've heard of before? And if for some reason, okay, we got a chat that unfortunately is not updating. Okay, sorry about that, everyone. If you could just drop it in the chat, that would work too. Okay, yes. So someone said Quechua, Mixteco Alto, Otomi, Nahuatl, Purepecha. Great. Okay. Well, thank you. Thank you, everyone. Okay, we see Mixteco Bajo, Triqui, Aguacateco, Mam, Chalchiteco. Okay. It's great to see some of these coming in. So we do have many of you who do know, or maybe I shouldn't say no, but have heard of indigenous languages or variants of them in the past. So while we may have heard of a couple of these languages or a couple of these variants, there are probably many more that we haven't heard of or that we don't know of. So on these next two slides, we have 68 indigenous languages just in Mexico. So take a look and see if you've heard of any. I think a couple of people mentioned Mixteco and Nahuatl. So I'll go to the next slide just so you can see the rest of this list. So if I go back, I have Mixteco highlighted here because we have these 68 indigenous languages just in Mexico. And then I've highlighted Mixteco because Mixteco itself has 81 variants of this language. And as we said before, many variants are mutually intelligible, but many are not. And mutually intelligible basically just means that two speakers of different languages could understand each other without speaking the other's language. So then here you'll see the indigenous languages of Guatemala on the left. And on the right, you'll see the languages and variants of the areas around Oaxaca in Mexico. As you may notice, languages and variants are specific at times from one town to the next, especially this map of southern Mexico here. And I tell you this not to overwhelm you or to make you think, how will I ever keep track of all these languages? But to make you realize that the way that we conventionally think about language in Western medicine may not work in this case. Many of us are used to preparing for interactions in either English or Spanish. Maybe if you live here in Austin, occasionally you might translate into Vietnamese or Korean here or there. But in this case, you may not be able to speak to someone in English, and then if that doesn't work, switch to Spanish and assume that you're covered. And this is one of the main challenges for both Indigenous communities and the organizations providing services, is even figuring out what language you need to translate into or interpret into. And this is why it can be extremely helpful to find out the hometown of your Indigenous peoples to figure out the exact language and variant that they need. And again, I just want to stress this idea of uncovering hometowns, because that's going to come in handy when Alexis goes over some of our strategies a little later. So next we'll cover cultural considerations for Latin American Indigenous workers and the implications that they can have in the delivery of care before, during, and after an emergency. So it's very important to understand that Indigenous peoples in Mexico and Guatemala have experienced centuries of discrimination and violence, as they have in the United States. And for this reason, they may be more hesitant to trust government officials. In Guatemala, for example, the Guatemalan Civil War took place between 1960 and 1996. So 36 years of war going on in that country. And the government and military were fighting guerrillas who fought for more equal land distribution and ownership. However, 83% of the casualties in this war were Indigenous Mayan people. And it had the effect of massively displacing communities, creating systemic exclusions and widespread trauma. And again, we see that Indigenous peoples are extremely diverse, but we see that unfortunately one commonality is that they experience disproportionate poverty levels in nearly all of their home countries, if not all of their home countries throughout Latin America. And throughout Latin America, Indigenous communities face poor outcomes in access to electricity, access to water, and literacy levels. So there's a strong significance around food, clothing, religious beliefs, and attachment to land and nature in many of these communities. Food has a strong connection to the land it's from. Many Latin Indigenous communities have an intimate relationship with the plants of the ecosystems in which they live, since these plants may form the basis of their diets or medicinal remedies. Clothing can be highly nuanced and denote subtleties such as social status or hometown according to the level of detail or the cultural symbols that are featured. And many Indigenous peoples are highly spiritual regardless of the religion they practice. Many Indigenous peoples are either a denomination of Christianity or Catholicism, but in many areas, Indigenous religions and traditions and rituals remain. One research study conducted in California interviewed between 44 Mixteco and Zapoteco women in a study that was looking at the barriers to healthcare. But at times we see these health-related beliefs surfacing. So there were many challenges that had to do with systemic issues, like an inability to afford healthcare costs, long wait times, rushed encounters with providers. But then something else that we see in some Indigenous communities is that these communities might only seek Western medical help only after their home remedies have not helped their conditions. One other thing to know about health-related beliefs in Indigenous communities is that Many conceptions of health may include the connection between culture, language, traditions, and even religious or spiritual aspects as critical aspects of health. So you might notice that in Indigenous communities, well-being is not just the absence of sickness, but rather a balancing of all of these different aspects of health. And one other important thing to know is that Indigenous peoples may be more likely to conceptualize health on a community level versus in Western medicine, we very much tend to conceptualize medicine as an organism level or an individual level. So this is a quote by Edith Matias Juan, who is an interpreter and translator of Dicha, which is a Zapoteco variant, and she is from Villa Diaz Ordaz. And so she was quoted as saying, "The Mexican government has produced a lot of information in Spanish for the community here. But for the Indigenous communities, it's not enough to just translate this information. As we translated information related to COVID-19, we also had to make it more relevant for our communities." So here she is speaking to the necessity to not just make literal translations from one language to the next, but actually to include a cultural understanding so that you can make these messages more relatable to these communities. And then again, going back to this conceptualization of health, she said, Indigenous communities care more about our communities than we do ourselves. So if we want people to stay home, if we want them to skip going to work, we can't tell them to just do it for themselves. We have to tell them to do it for their communities. Something else that we saw with research done by Dr. Laura Gonzalez out of Florida was that for many Indigenous communities, there is this, there's not as much of a fear of death as we may experience in other cultures. And because of that, like fear-based messaging may not work as well with Indigenous communities, like telling you must act or else you'll encounter danger, you have a risk of dying. Because there's this connection with death, they might be less likely to act in that situation. And they described efforts with COVID where they actually formulate the things in basically a celebration of life. So like by taking these protective measures, you can embrace life essentially. So next we're going to go over how Indigenous agriculture workers and some of the things that the challenges that they face interface with national emergencies to create different outcomes. So with any of these topics, we want to look at the challenges, but we also want to look at the strengths of these communities. We don't want to just focus solely on the discrimination and challenges that they face, because they are a community with particular strengths as well. So we'll go over challenges first, and then we'll talk about strengths in just a moment. So as we've mentioned, some of the challenges that Indigenous communities face are that they experience discrimination in both their home countries and in the US due to racism, language, cultural practices, and body type. And as we go through each of these challenges, I want you to think about how might these things show up during a national emergency, right? Research indicates that Indigenous agricultural workers face challenges such as isolation, discrimination, extreme poverty, and they experience greater barriers to workplace safety due to language barriers, right? So again, all of these challenges are only being exacerbated during a national emergency. Indigenous communities already face higher stress levels and levels of food insecurity. So you can imagine how an emergency would only exacerbate these stress levels. And in many cases, a national emergency will also make food insecurity increasingly critical. We also see challenges associated with agricultural working conditions in general, right? A lot of these communities are working in agriculture, and so they have the same risks as non-Indigenous or Latino workers. So things like exposure to the elements, dangerous work, inadequate housing, social isolation, and lack of transportation. And then we want to talk about strengths. So Latin American Indigenous peoples have created and continue to create multiple political movements to advocate for greater access to healthcare, education, economic opportunities, rights to land, and recognition of their languages and traditions. They also have shown a strong ability to maintain networks of mutual support and strong community ties. And traditional forms of medicine can also be an accessible form of medicine, and also perhaps more importantly, give communities a sense of agency over their health, and make them feel that they have control, right, over their health and their lives. So here we just I pulled together a couple of elements to underscore how these challenges that Indigenous populations face can create even poorer outcomes when they're combined with national emergencies. So on the top here, we have an extreme heat event. So if you can imagine, many agricultural workers live in substandard housing with no air conditioning. So if this is the case also for Indigenous workers, which we know oftentimes it is, you combine that with an extreme heat event. And then you also combine the fact that emergency warnings are often broadcast in only English and Spanish. So you can imagine, these populations are vulnerable to the elements. They haven't received proper warning about the emergency. And so you might see increased risk of heat stroke with no resources to call for help, right? Or they call for help, but no one speaks their language and no one knows how to even figure out what language to translate into. Another situation, which we're all very familiar with, is a pandemic, right? You have close proximity to others during work and leisure time. You combine this with a disease outbreak and a lack of culturally responsive outreach materials. And you'll have, as we've seen during this pandemic, worse disease outcomes for Indigenous populations. So lastly, before I turn it over to Alexis, I just want to go over why is it so important to prepare for emergencies with Indigenous communities. And I have a couple examples here, but I'm also very curious to hear what is your why. So go ahead and share in the chat, why do you feel that it's so important to prepare for emergencies with Indigenous communities? A couple things we thought of were equity, right? So we know that both throughout Latin America and in the United States, Indigenous communities are facing worse outcomes compared to their peers. And so preparing for emergencies with Indigenous communities can help to make up for some of that deficit, right? And especially focusing on this community. The other thing is that Latin American Indigenous workers in the US in agriculture are only expected to grow in terms of numbers in the coming years. So if you have a couple of Indigenous ag workers in your area, you can expect this trend to grow and these numbers of people to increase into the future. And we've also lived through emergencies in the past couple of years. I think all of us have gone through at least a couple of emergencies, if not overlapping emergencies. And so we have an opportunity to learn from these experiences to serve communities better in the future. So I'm curious, what is your why? Why do you think it's important? You can go ahead and share it in the chat. I'll give one more minute just, just in case you're thinking on it. Yes. So someone said is public health, right? Um, yeah. So although there's not a lot of research that goes into these communities, they are part of the public that we serve, right? And so they're an important part of our work. Um, Someone else said most emergency preparedness information is only available in English and Spanish, and these populations may be left behind. Exactly. Yes, Cecily. Someone else said Indigenous communities are critical and deserve the same access to information and resources as anyone else to be safe. Yes, yes, Adriana. Um, so exactly, these communities deserve the same quality of care, and many times we have the ability to remove some of these obstacles to access to care and safety. Someone else said to avoid tragedies and even death. Exactly. We have the opportunity here to actually save lives, right? That's a huge reason why it's so important. So thank you, everyone. Thank you for participating and thanks for sharing your why. And so now that we have a greater understanding of Indigenous populations, how they're affected in national emergencies, and why this work is so important, let's move on to strategies you can use to achieve greater equity in your emergency responses. And I'll turn it over to Alexis.
Thank you, Caitlin. All right, now, as Caitlin mentioned, we have this background of this population and the different characteristics and race that they may be exposed. So we want to talk a little bit more about you as health centers, as providers, as advocates. What can you do in order to help these indigenous communities? So we can please turn to the next slide, Caitlin. So here we have two main concepts or two main aspects that health centers can focus in order to help indigenous communities throughout national emergencies. So in first place, we have your role as partners in healthcare and communications. You're not only providers of healthcare and different tools, but also you are great members or partners in communications with the community. And in second, or number two is that you can provide strategies to prepare and promote different actions throughout national emergencies and reduce those risks or to avoid those strategies as you mentioned in the chat. So we can go to the next slide, please. So health centers can act as partners, as I mentioned, providing continuity of care before, during, and after national emergencies. So communicating with indigenous populations is key to inform them in preventive measures, prompting life-saving actions, and connecting them with essential resources once the different disaster or emergencies have passed. But then we ask ourselves, how can continuity of care be addressed? So we can develop and adapt emergency preparedness plans. So we can develop those plans, or if we already have plans to act upon emergencies, we can adapt them or tailor them to include indigenous populations. So we need to consider unique needs of the indigenous communities. Health centers may develop specific emergency responses tailored to this population and their characteristics, as I mentioned during the crisis. So we have a couple of tips here that those plans should include, for example, a hazard assessment of the disaster, particularly those dangerous risks or those risks specifically for the indigenous populations. And we need to include this due to the exposure of the different elements that they are, not only heat, natural disaster, but also how could this relate or is linked with those barriers in language and communication with the population. Emergency mitigation strategies to consider their potential lack of transportation, mobility, and differences in language and culture. Like Caitlin mentioned before, we need to take in consideration their religious beliefs, their social beliefs, their culture, different characteristics depending on their gender, their age, um, uh, the how related they are with Western medicine, and what are they the preferred methods or the preferred ways to uh, uh, target or any kind of disease or illness. We also need a network of interpreters, translators, and community organizations that speak their language and they are familiar with their community, because it's not only having people able to interpret for them and also for you as providers, but also we need to get engaged with the community in order to earn their trust. And then we have a detailed organizational map of the staff roles. What are the tasks specific for your teammates, for your health centers, and also for any other advocates or partners that might want to team up with your health center in order to provide services. In second place, we have knowing your indigenous patient population in order to provide access to healthcare. So, knowing the population is essential for any health center to communicate any critical information during a national emergency, and this will also help you tailor any messages or and determine any specific information that you would like to share with your patients. So in that assessment, you need to gather information such as demographics, age, gender, the race, their ethnicity, also geographic location and region. This is very important, as Caitlin mentioned before, because language we have language barriers. Variants depending on where they live. So it is very important also to have that information, the preferred language or languages, or even the variants that they feel more comfortable speaking or they prefer. Also cultural considerations that we mentioned before, any kind of primary health conditions that they may have at the moment of gathering that information, and also literacy levels, how well they understand what the emergency is, how can act upon the emergency, and how could you as a provider can help them or can educate them in a way that they understand what's happening and what are the actions that you want them to take. And last but not least is identifying that staff that is involved in the emergency response plan. So it's very important to in this process to identify what are the tasks, who are taking power or control over those tasks, what are the different roles, and what is the flow of this process involving the health center, the partners, and the community when you are working through our national emergency. If we can move to the next slide, please. So then let's talk a little bit more about the role as partners. So health centers are capable of developing and providing patient health education resources to mitigate the impact of national emergencies or disaster in this community. So using patient education is very important. So you can educate them in preventive measures. Also, access to the essentials. They need to prepare, as we mentioned, the emergency kits. For example, what kind of food they might need to gather or save, potable water, what kind of medications they might need and they're not aware of, and also other any other needs for the family. Also personal information, important documentation that they might have, it's very important. Also proper channels to access information before, during, and after an emergency or a disaster, but in their preferred language, very important. And also, we want to share with them some life-saving actions. Know and learn about different types of emergencies and how they need to respond to them in order to prepare for each one of these. Also, learn about evacuation and safety as the primary actions in this kind of emergencies. And also, you would like to share with them or take in consideration any other social determinants of health needs that might that might be affecting indigenous population, excuse me. So health centers are able to assist indigenous communities with needs such as connecting communities to emergency recovery resources. Where can they access food, access to healthcare, who is providing different healthcare services, if there are any transportation services around their areas, if there is housing or shelters available for them in case of any of them losing their living places, what kind of resources around income are available, and also language access, what kind of services or what kind of aids they might uh, find related to, to decrease those language barriers, and also other referrals to any other health or social needs. So if we move on then to the next slide, please, I'm going to share with you some strategies that health centers and other indigenous ag worker population advocates can do as part of this national emergency response. So on the next slide, we see on first place, hometown networks. So hometown networks, these are groups of people from the same region in their home country who share the same language, traditions, and any forms of support. Excuse me. They are a great resource for connecting and learning patient-specific information. So these hometown networks are a good place to start gathering those or doing those assessments to gather that information. So you can contact your public health department or your local public health department, and you can connect, or they can connect you with these hometown associations, these hometown networks. So we use this term hometown networks to refer to any kind of social structure that exists among people from the same villages. It could be either in Mexico, Guatemala, or any other Central American countries. And these are social relationships and cultural patterns formed in these hometowns that are crucial to the behavior of this. Of many immigrants from rural areas, and they constitute an internal structure that provides support and comfort to its members. So indigenous farm worker networks, or experience has taught them not to trust outsiders who has traditionally discriminated against them. As we saw in the background, they have faced many challenges with different communities or other cultures, but and that's why they have formed these networks. But our job as provider is just to, as I mentioned earlier, to earn their trust, to let them know that we have advocates, that we have services that can be reached, or they can trust us in order to improve or in order to help them manage any kind of national emergencies. So next we have inform and train healthcare staff. On the next slide, please. So as health centers, it is important to ensure that your staff is properly trained about indigenous ag worker patients to respond to any of their needs during a crisis or national emergency, and maintain that service delivery to this vulnerable population. So, staff, health center staff, or any other advocate or organization should prepare emergency procedures and receive prior training on the following: that what kind of policies your health center organization have for each type of national emergencies. We know that emergencies, they vary depending if it's a wildfire, it's a hurricane, if it's a snowstorm, an earthquake. So there are different plans and different strategies depending on what kind of emergency we might be facing. HIPAA regulations also is very important when you are gathering personal information, just to make sure that privacy is secured. Safety plans for the indigenous populations, any kind of cultural considerations, emergency response communication and messages have, as I mentioned before, it's very important that they know what kind of message they might understand, what kind of images you need to use in order to let them see themselves represented. Um, translation or any other interpretation services that are available. It's very important that your staff know who to reach out, who to get in contact with in order to improve or secure this process of communication between providers and also patients. Number three, we have identify and build partnerships. This is one of the main strategies, identifying partners who can offer services. In the next slide, please. Thank you. So identifying partners who can offer services and support during national emergencies and who can play an active role in your emergency response plan. So consider partnering with churches, faith-based organizations, libraries, schools, daycares, recreational centers. So it's very important um, that you reach out to those members of the community. Um, Also create or assess and establish collaborations. It is very important that uh, with these key partners or trusted private or non and government organizations, you need to ensure that they understand also the patient population and they are also aware of these specific cultural considerations. So a good strategy is to create a database with this partner information that are working with you. For example, getting their primary contact information, telephone number, emails, mailing addresses, and websites. But you also want to update this information on a regular basis just to ensure that your information is current. So also identify specific resources and any other support that your partners may offer, especially those that the community may already rely on. So if you have any gaps on your health centers or of the services that you as an organization or an advocate of indigenous population may have, you can partner with some other organizations that they may provide those services and you can complement each other. So, and some examples of these supports or resources are childcare and education through schools and daycares, any food assistance through community or recreational centers, as I mentioned before, social or emotional support through cultural centers, any kind of like the networks that we mentioned before, faith-based organizations and others, and then transportation support through bus lines or any other public transportation services. If we can go then to the next slide, please. So, and then last but not least, the use of communication channels. So, um, communications are effective with Indigenous act workers, and we have three main channels. And number one, excuse me, we have radio. So, given that this population works long hours and they might experience lower literacy levels, broadcasting auditory information via radio can be a solution. So we have some examples here for like Radio Indigena that they are based in Oxnard, California. They provide program in 7 Mixteco languages, Zapoteco and Purepecha. We have there some other partners like Radio Bilingüe. Both of them have partnered with NCFH in creating PSAs for indigenous populations, and we're going to share with you some examples. And number two, we have community workshops. So this is something that we have done throughout the years, and it's something that is very effective. So going directly to your population is one of the main or the most effective ways of communicating. So these workshops can be done in the site of labor housing. It can be done in camps, in farms, etc. So here you can provide most types of messages, including visuals, videos, and in-person patient education. Sorry, excuse me. So, and number three, we have social media. So in most areas where indigenous languages are being broadcasted, or most areas are limited when broadcasting indigenous languages information or education. So communities rely heavily on social media and messaging apps such as WhatsApp, where you can share audio, images, and text messages. So identifying these community leaders or highly followed platforms to amplify your message and share any kind of communications will increase the trust in the of your health centers with these indigenous communities. So very important that no matter what kind of channel you are using, you need to develop tailored communication. So for example, there are some steps that it can help you initiate media communications with special population, such as following resources like the circ rhythm developed by the CDC, um, selecting carefully your communication channel. If you're going to use radio, if you're going to use WhatsApp, if you're going to use any other kind of like text message, what is the main communication channel that they feel more comfortable using? It is very important for you to create concise, actionable messages using as little text as possible. So you might want to use more videos or more images that they feel more related to. If you need to translate your messages in the language that your population feel more comfortable, also considering culture and interpreters who we rely on your message should also be familiar with what are the health beliefs and the norms of this community, which is very critical to ensuring that these emergency communications are culturally appropriate. So not only you as a provider need to be aware, but also your partners and the interpreters that might not always be part of the community. So they might also be trained about those cultural aspects. Also, test your message. It's very important that if you have a group of audience, if you had an audience from that community, test your messages with them and also and receive that feedback in order to tailor those messages even more or know if they are accurate or not. And last but not least, you need to distribute your messages through health center channels, also getting in touch with community leaders and using your media or communication networks. So we have here on the next slide a couple of examples of these strategies. And you can see if we can click on the first one, we have a radio PSAs that NCFH has worked with some partners. You can click on the icon on the little speaker icon, and it will turn. Yeah, it will start the audio, Caitlin. So this radio PSAs is an example of two um, uh, ag workers who are talking about getting vaccinated. There are two compadres, and it's a short radio PSAs that you can also work with your partners in order to create those tailored messages. Okay, let me know if you are able to share the screen again, Caitlin.
Yeah, sorry, Alexis. I just need to pull it back up
No problem.
with the sound share.
Okay, great. So, and while Caitlin is helping with our troubleshoot, we also have educational videos that they have been developed also by organizations such as Ready.gov. And NCFH has also developed some educational videos in English and Spanish, but also collaborating with other organizations are creating flyers and handouts, not only in English and Spanish, but also in different indigenous languages from Mexico, from Central America as well. So another strategies are creating songs. So as you know, like music is one of the main communication channels. So creating these messages in a way that they feel related and they like. So that's something very important. That's one good strategy in order to reach out to the community. And also using community testimonials. So, for example, any kind of stories that you have from from community members, you might also would like to use them as part or examples of um, of educational strategies. Okay, so let me know if we have a couple more minutes. We can at least share one of those.
Estuvo dura la pizca, compadre, pero voy a apurarme para ir a vacunarme contra el COVID.
¿Para qué, compadre? Si ya tuvimos el virus, estamos protegidos.
No, fíjate, un doctor dijo en la tele que aunque hayamos tenido COVID, hay que vacunarse, porque así queda uno bien protegido.
No más porque confío en usted, compadre. Vamos, pues.
Ese es mi compadre.
Visítanos en la página Una Voz para la Salud, en Facebook o Instagram.
So this is one example of a message that you can use as a radio PSA in order to reach out to those communities. And you can see you can create 30-second PSAs. You can create 60-second PSAs depending on how much information you would like to share. And you can use different elements that are culturally relevant. And as you can see there are two resources or two links where you can access a lot more resources. We have ready.gov and we have linked there NCFH, where you can find a lot of different materials, not only in English and Spanish, but also in different indigenous languages, as I mentioned before. So thank you very much. I think we can move on then to our Q&A. If you have any questions, any comments that you would like to share, if you have any other examples of other strategies that you use in your health centers, you can share those with us. We have like 5 more minutes to respond to any questions or if you want to share anything with us related to this topic.
And we'll give everyone just another minute to think of any questions you might have. I'll check the chat to make sure there are none in there, but feel free to use the Q&A, which should be in that same black bar that pops up either at the bottom or the top of your screen to ask any questions.
Great. I think we don't have any questions so far. So in the chat, I saw Maria. Thank you for sharing this tool with the audience. Important that we're gonna share with you some of our tools that we have created. But before moving on to those resources, we want you please to rate or complete our evaluation. So you can scan the QR code, or also you can access the link that I'm going to share with you in the chat right now. And you will be able to click there and complete the evaluation of this webinar. So we have a question. Do you know any states or public health divisions that are implementing these strategies?
Yeah, go ahead and complete the evaluation, everyone, but feel free to keep putting questions in the chat or the Q&A area. And we will also show our contact information at the conclusion of this. So if you have any lingering questions that you think of later, feel free to reach out at any point. Alexis, I don't know about you, but to answer that last question, there is, they might actually be here. I don't know if Mariana Blanco from the Guatemala Maya Center is here. But I do know that some organizations across the country do try to partner with their public health departments in order to basically make public health resources more accessible to Indigenous populations. Especially, for example, in the case of the Guatemala Maya Center, they have a really robust network of volunteers and translators that can translate into various Mayan languages and variants.
And this is in
Um, it-
Florida.
Yeah, this is in Florida. So I'm not sure if they partnered specifically with the public health department, but I do know that they have partnered with their city services in a variety of aspects in order to coordinate access to services during an emergency and you know to it basically so that Indigenous populations can access services during emergency times and during normal times, right? Because many of these public health departments might not have these translating services themselves. So sometimes if an organization or even a health center is really well connected with translators or identifying Indigenous languages, they might partner with the public health department to achieve better outcomes. And that's part of that partnership building, right, that we addressed earlier. I don't know if Mariana's here. If you are Mari, if you wanna, if you care to request to come off mute and you could share, but if not, that's okay.
So I want to share before we have a couple more minutes. So I want to share some resources that we have on our website, and we will be sharing this presentation with you. If you can go to the next slide, please. Great. So there are some resources that we're going to share with you. In first place, we have an emergency preparedness toolkit for community organizations. You can take a look at this at these guidelines if you are in the process of creating a plan or creating different strategies to target emergency preparedness. Also using those to update any plan that you have to include Indigenous communities in them. We also have another resource called CDC's Access and Functional Needs Toolkit. So it's another toolkit that CDC is sharing or having available, where you can download, or you will have access to different other strategies that you might want to develop or incorporate in your plans. We have a tool, a downloadable tool that have all this information that we have shared more concise. You can use them to give to your health center staff, to your partners, and other advocates, called the Effective Communications with Indigenous Ag Workers During National Emergencies. And NCFH has also developed a fact sheet around Indigenous ag workers, where you can have, or you can see a lot of information from places they come, what kind of languages, and what are the different challenges that they are facing. So you please check that fact sheet out. And we have some COVID-19 resources for Indigenous populations in our website. So check these links that we have shared with you. You will see that webpage is full for it with great information, different COVID-19 fact sheets, downloadable tools in different Mexican and Central American indigenous languages. So that will be, that website or that page in our website is very will come in handy when you want to share COVID information with indigenous communities in your areas. And we have some other uh, resources that we always want to share with you. We have the program called Una Voz para la Salud. We have there the phone number and also the WhatsApp number, so you can share this with your organizations and also with your partners. And Una Voz para la Salud, or Call for Health, is a helpline for farm workers or their families, and they connect farm workers with healthcare and the other social services. And they also assist workers with limited financial resources to pay for healthcare services. On the next slide, we'll see different projects or concepts or different areas that NCFH covers. So you will find all the information that you need in these different links that we are sharing with you. So check our website, ncfh.org, and you will find all different kind of resources, health education, governance, staff training, etc. And then we have our different social media. You can find us on Facebook, Twitter, Instagram. We have a YouTube channel that you can check out where we have different archive webinars, and you can also find us on LinkedIn. And we also have our newsletter. So we have NCFH newsletter, and we also have a Boletín Sol a Sol. NCFH News share all the different resources and different events that are happening. And, you can find those or get connected with NCFH. And we also have the Boletín Sol a Sol that is specific for COVID-19 resources, webinars, and many other tools that are related specifically for COVID-19. And we have one more webinar coming up in May 19th. It's very similar. It's a similar topic. It's effective communications, but with migratory and seasonal agricultural workers during national emergencies. So we're going to have like a second part of this webinar in May 19th, and it will be the same hour, 1 p.m. Central Time, 11 a.m. Pacific, and 2 p.m. Eastern. And we're going to share with you the registration link in the chat, and also when you receive this this presentation, you will be able to get registered. So again, thank you very much for staying tuned, for joining us this webinar. Please get in touch with us. These are our contact information, Caitlin and I. So feel free to send us a message, give us a call if you need any more information or would like to access more resources related to this topic. So thank you very much.